Welcome back. Michigan's government has a checkered history with mental health care, and as our Capitol correspondent Tim Skubic explains, he has had a front row seat for many of those challenges.
He's here for you tonight with how things went in decades past and how elected officials are trying to make the situation better.
It was former President John F. Kennedy in 1963 who wanted to move patients out of aging and often dangerous insane asylums across the country and create a community mental health clinic system. The federal money didn't follow to implement. Then, in 1992, Michigan Governor John Engler wanted to shut down the state's 16 psychiatric hospitals, including the Lafayette Clinic in Detroit. He ordered the state police to remove the patients. Many mental health advocates in the state think that was the low point in the state's mental health effort. But the legislative attitude in recent years towards mental health has flipped from cutting to spending. This mental health advocate gives lawmakers a score of 9 on a 10-point scale.
I give them a 9. I think they've done an incredible job this last year or two. There's some wrinkles, of course, as there always are, but very high marks.
The Oxford High School murders, COVID-19, and the MSU murders all raised the visibility of the mental health issue.
Yes, and it's sad to say, right, that it takes such tragedies to do that. Kids and adults are talking about it more than ever. I think it reduces stigma.
I'm going to give the legislature a solid 8.5.
Ian Perry recalls in 1955 nationwide there were 350 beds for every 100,000 persons. The number is now 17 at a time when suicides are rising.
We've seen rises in rural veteran suicide. We've seen rises in women veteran suicide. We've seen rises in rural population suicide. And Native American, Alaskan, and Hawaiian suicide has gone up.
And it's a silent killer among first responders of all people.
Don't want to be pulled off the line. They don't want to be pulled out of the squad car. They don't want to be pulled off the job that they love to do. So we need helpers to help the helpers.
Students who suffered during the pandemic and now post-COVID got quality mental health care in the schools. But the federal money to pay for that is now gone.
Some districts made decisions to hire mental health folks.
On the legislative front currently, there is one silver lining.
I've been surprised. Folks in the far left and the far right all seem to rally around mental health needs.
But he confesses when it's a battle for dollars between public health and mental health, this is what's happening to mental health.
Though it's still at the bottom of the totem pole.
Everybody agrees that more spending is needed. Here for you in Lansing, Tim Skubic, 6 News.
And we have a special coming up at the end of the month that tackles various aspects of mental health. And we also have resources to help you or a loved one cope. You can find those on our website right now, WLNS.com.